Hello, viewers. Today we have Dr. E.K. Gupta with us. Dr. Gupta, could you please tell us something about yourself?
I am Dr. A.K. Gupta from Maulana Azad Medical College, New Delhi, practicing in North Delhi for last 44 years, since
Uh,
January 1980.
Dr. Gupta, how long does it take to create a vaccine under normal circumstances?
Creating a vaccine typically takes 10 to 15 years under normal circumstances, and this lengthy process involves several phases like exploratory research, preclinical testing, clinical trials, and regulatory reviews. So it takes about 10 to 15 years under normal circumstances.
How did we manage to create COVID vaccine in only about an year?
Yeah, it was a rapid development of COVID-19 vaccine in about a year and was driven by several key factors like advanced technology, global collaboration, simultaneous trials, and of course, financial support. So, because of these things, it was possible.
So many people feel that COVID vaccine has many side effects, and the side effects are because the vaccine was developed in 1 year. Had the vaccine been developed in about 10 years' time, probably the side effects wouldn't have been there. So, what's your opinion on this?
While some rare side effects such as myocarditis and anaphylaxis have been identified, they occur at very low rates, approximately 5 cases of anaphylaxis per million doses, and most side effects are mild and temporary, like soreness or fatigue. The benefits of vaccination in preventing severe illnesses and complications from COVID-19 significantly outweigh these risks.
Okay.
So
So,
it
hmm.
had to be developed early.
So you feel that the benefits far outweigh the risk of the
Yeah,
vaccine.
yeah,
So
yeah.
India recorded about 5,31,794 coronavirus deaths since the epidemic began, according to the World Health Organization. Do you think it could have been worse if the vaccine was not rolled out?
India's rapid COVID-19 vaccination rollout starting on January 16th, 2021 significantly mitigated the impact of the epidemic. By December 2021, over 1.8 billion doses were administered, leading to a substantial reduction in severe cases and deaths also. So it was essential to roll it out earlier.
So you feel that the decision of rolling out COVID vaccine in 1 year has actually benefited us because the number of deaths have reduced to a greater number
Deaths and of course the severe cases also, they have also reduced.
and the severe
Without
case.
vaccination, deaths could have been much higher in India, and the swift vaccine development plan played a crucial role in limiting fatalities and during the pandemic.
Okay. So during the development of vaccine, there is a preclinical stage in which vaccine is tested on animals for about 2 years. How
Yes,
important is this stage in development of the vaccine?
the preclinical stage of vaccine development is crucial for assessing safety and efficacy before the human trials. This phase typically lasts for 1 to 2 years. The regulatory agencies like the FDA require comprehensive data from these studies to ensure that only safe and promising candidates advance to clinical stage. Preclinical studies help identify effective vaccines and minimize risk in subsequent human testings, making them an essential step in vaccine development.
So don't you think that preclinical stage in development of COVID vaccine was reduced or skipped altogether? So that could have been dangerous, though it was.
Yeah, this is to expedite the process during the emergencies and is achieved by overlapping phases of clinical trials and leveraging existing data from related vaccines, which can provide insights into the safety and efficacy without extensive new testings. And regulatory bodies like the FDA, as I told you, may allow this acceleration when the urgency is high and the potential benefits outweigh the risks, ensuring that safety remains a priority throughout the process.
Okay. So your stand remains that the benefits were far more than the risk associated with the
Yes,
COVID
yes,
vaccine. It was
yes,
important to
yes.
roll out the COVID vaccine in 1 year, else the
Yeah.
damage could have been much, much worse. Okay,
Yes,
so
yes, yes.
now
Yes,
it is said that Mpox vaccine might be rolled out in 1 year. Do you think
yes,
this
yes.
would be a good decision?
The potential rollout of Mpox vaccine, the monkeypox vaccine, within a year appears to be a strategic decision aimed at curbing outbreaks. The World Health Organization has emphasized the need for comprehensive vaccination efforts to interrupt the transmission chains, particularly among vulnerable populations like healthcare workers and close contacts of the cases. Given the rising number of cases and deaths in regions like the Democratic Republic of Congo, timely vaccination could significantly mitigate the public health risks. Thus, the decision seems prudent in enhancing the global health security.
So I fully understand that Mpox vaccines rollout would be as important as COVID vaccines rollout. Do you
Yes,
think
yes,
that
yes.
even in case of development of Mpox vaccine, they will have to bypass preclinical stage? And
No,
should we be worried
vaccination.
about? Should we really be worried about it, or should we be happy about it?
Vaccination against Mpox is crucial for controlling its spread, particularly among high risk populations. While bypassing the preclinical stage of vaccine development may seem beneficial for rapid, significantly reduced deployment, it raises safety and efficacy concerns. Current evidence shows that two-dose vaccination campaigns significantly reduce Mpox cases, with studies indicating an 86% effectiveness after a single dose in high risk groups. Thus, while vaccination is essential for public health, ensuring rigorous testing remains vital to prevent adverse effects and ensure long term safety and efficacy.
Okay, so as per you, people should not worry about Mpox vaccine being rolled out in 1 year. Rather, they should be happy
Yes, yes,
that it will
correct.
be stopping the spread of Mpox, and they should be happy that they probably might not
Yeah,
get the
yeah,
disease, or even if they do, it will be curable.
correct, correct. Yes.
Thank you so much. Would you like to add something?
Yeah, the benefits of Mpox vaccine weigh the risks. I would like to say, particularly the MVA BN vaccine generally outweigh the risks, especially in the outbreak settings. And WHO recommends vaccination for high risk groups and emphasizes its importance outbreaks and controlling outbreaks. Thus, vaccination is crucial where exposure risk is significant.
Thank you
And what
so
I
much.
say,
Yeah.
I would say this also: the early rollout of Mpox vaccination in Democratic Public Republic of Congo is a significant step in combating a severe outbreak, especially given the emergence of a more infectious variant. While the initiative is commendable, concerns arise due to limited vaccine supply. Only 265,000 doses for a population of 100 millions. So overall, while the vaccination drive is a positive development, it highlights the urgent need for increased resources and international support to effectively manage the crisis.
Thank you so much, doctor, for your valuable time and for telling the people that there's nothing to be worried about. If the vaccine gets rolled
Yes,
out
yes, yes.
in 1 year, it's far more beneficial compared to the risk.
Definitely, definitely,
Thank you
definitely.
so much, sir. Have a lovely
Okay.
day. Thank you.
Thank you. Thank you. Thank you.